Welcome to another video where we'll talk about symptoms of liver damage that you should know. Your liver, which sits under your ribs on the right side of your belly, does many important jobs like filtering blood, helping with digestion, and getting rid of toxins. When your liver gets hurt and can't work well, it's called liver damage. This can get really serious and even lead to liver failure, which needs quick medical help. Liver damage usually happens because of things like eating too much junk food, drinking too much alcohol, taking certain medicines, getting certain infections, being overweight, or having certain health problems. It can take many years for liver damage to get really bad, starting with inflammation, then scarring, and finally liver failure. Some common liver problems include fatty liver disease, liver damage from drugs or alcohol, hepatitis, and liver cancer. In this video, we'll talk about 14 signs of liver damage, from early ones to more serious ones. Remember, this video is just for learning and doesn't replace advice from a doctor. Fatigue and difficulty concentrating. Fatigue and difficulty concentrating are common when your liver is damaged. The liver has to work harder to do its important jobs, which can leave you feeling tired all the time and struggling to focus. As the liver filters out toxins slower than normal, it also becomes less effective at breaking down food and absorbing the nutrients needed for mental clarity and overall well-being. In severe cases of liver disease, this can lead to hepatic encephalopathy, which is brain damage caused by high toxin levels in the body. Impotence and loss of libido. Erectile dysfunction is common in men with non-alcoholic fatty liver disease, NAFLD. Liver damage can also reduce sexual desire. While the exact reasons for these symptoms need more research, experts believe they may stem from imbalances in sex hormones often found in liver conditions. Additionally, alcohol consumption appears to contribute to the loss of sexual function, especially in men. Changes in skin. When your liver is damaged, you might see changes in your skin. Hormonal shifts can make small blood vessels expand, causing spider veins, especially on your face and torso. You might also notice red patches on your face, palms, and feet, which can be from hormonal changes, lack of certain vitamins, or high blood pressure in your veins. In severe liver damage, jaundice can happen, making your skin turn yellow. Jaundice occurs when a waste product called bilirubin builds up because the liver can't process it properly. Easy bruising and excessive bleeding. Your liver is important for making proteins that help your blood to clot. When the liver is damaged, it struggles to support proper blood clotting after an injury, leading to more bruising or bleeding. Frequent nosebleeds, bleeding gums, or prolonged bleeding from simple cuts could indicate potential liver issues. Another problem can occur when new blood vessels form to bypass the damaged liver due to portal hypertension. These vessels, often in the esophagus and stomach, can swell and cause severe bleeding, especially if blood clotting isn't working well. If you experience symptoms such as vomiting blood or black stool, it could be a sign of gastrointestinal bleeding, and you should seek immediate medical help. Loss of weight and muscle wasting. When your liver isn't working right, it can lead to malnutrition. This often starts with a lack of appetite or feeling sick a lot, which can make you lose weight. For people with cirrhosis, not wanting to eat much or having a poor diet can make them lose muscle and strength. They might experience fast muscle wasting, where not eating for 10 hours affects them as much as 3 days of not eating would affect someone who's healthy. Abdominal swelling and pain. Abdominal swelling is a common sign of cirrhosis. This swelling, called ascites, happens when proteins in the blood are lost, causing fluid to leak out of blood vessels and collect in the space between tissues lining the abdomen and abdominal organs. This fluid buildup puts pressure on the abdomen, causing discomfort and pain. Portal hypertension, which is high blood pressure in the portal vein delivering blood from the digestive organs to the liver, can also lead to ascites. The increased pressure and blood pooling can enlarge the spleen, causing pain in the upper left side of the abdomen that may radiate to the back. Loss of appetite. When your liver is damaged, it has trouble breaking down fats and proteins from your food. This can make it hard for your body to produce B vitamins and process fatty meals. If you have long-term liver damage, you might feel sick, throw up, or lose your appetite for foods that are high in fat and protein. Sleep disturbances. People with liver damage often have trouble sleeping. This gets worse as the liver disease gets worse, creating a cycle of bad sleep and declining health. You might struggle to sleep because of discomfort from symptoms like belly swelling or mental changes linked to hepatic encephalopathy. If you're finding this information helpful, remember to like, share, and subscribe. Don't forget to turn on notifications so you don't miss any videos. Nail changes. Different types of liver disease can affect the appearance of nails. For example, Terry's nails, which are mostly white with a thin reddish-brown strip near the tip, are often associated with liver failure or cirrhosis. In a study, 68% of liver disease patients with cirrhosis, hepatitis C, and hepatitis B showed nail changes, compared to only 35% of the control group. The most common change was a fungal nail infection called onychomycosis. Other changes included longitudinal grooves, brittle nails, finger clubbing, and nails that were thick, deformed, or discolored. Itchy skin. Experiencing itchiness, especially on your palms and soles of your feet, could be a sign of liver disease. This itchiness happens when bile flow from the liver is restricted or stopped. It can be really intense, making it hard to sleep or do daily tasks. The itching doesn't usually come with a rash or skin sores, and scratching doesn't make it better. It can affect one area or your whole body. Changes in urine. Dark urine is often an early sign that bilirubin levels are high. This occurs because the damaged liver can't break down this yellowish pigment and remove it as it should. When bilirubin isn't effectively eliminated through stool, it circulates back into your bloodstream and is then filtered out by your kidneys, causing the urine to darken. Changes in bowel movements. When your liver isn't working properly, it can affect digestion, leading to the body expelling more toxins through bowel movements. This can cause either constipation or diarrhea. In advanced liver damage, the liver might have trouble producing and processing bile and bilirubin, which gives stool its brown color. As a result, stool can become pale in color. Swelling in legs or ankles. Liver damage can cause fluid to build up in your ankles and legs. This occurs because the loss of blood protein allows fluid to leak into the tissues, especially due to gravity pulling it downwards. As a result, the legs and ankles are often affected, with noticeable puffiness seen around the lower limbs in the late stages of liver damage. Bad breath fever. Hepatitis is a chronic odor in your breath that is different from normal bad breath and is a distinctive symptom of liver disease. It's not related to dental hygiene and can't be solved by brushing your teeth more often or using special mouthwash. The scent is often described as a mix of rotten eggs and garlic. This symptom usually only appears when there is significant liver damage and can only be resolved by treating the liver disease itself. If you experience more than one of these symptoms and they persist, it's important to consult a healthcare professional who can assess your liver function. To prevent liver disease and promote healing, it's recommended to eat an anti-inflammatory diet. If you interest this video, hit that like button. It not only supports our channel, but also helps others discover this crucial information. Don't forget to subscribe and turn on those post notifications to stay up to date with more exciting content, because we've got a whole lot more in store for you. See you in the next video.